Among those patients who have contracted HIV, there is often a dramatic and sudden loss of weight in the latter stages of AIDS, as the patient's face changes appearance due to this weight loss. There have been recent developments to assist patients in maintaining their appearance. Dr. Timothy Jochen of Contour Dermatology in Palm Springs explains.
Some people are born with facial defect, but the thing that I'm seeing most commonly in my practice is lipodystrophy or facial fat loss secondary to HIV. And we're not really sure what causes the facial wasting in HIV. Some people believe it's secondary to the medications, and we know for sure that it can accelerate the loss of facial fat. However, some people that aren't on medications also will get facial wasting. So the type of facial wasting that I'm treating is almost exclusively HIV related. This procedure, what I'm using is an FDA-approved form of silicone. It's called Silicone 1000. And what I do is I inject microdropules of silicone underneath the skin. And with this technique that I'm using, we sort of minimize the old things that used to be problematic with silicone. First of all, there were problems with tissue reaction to silicone, because anytime you put anything foreign underneath the skin, there's a possibility that the body could reject it. And that can happen whether you're doing a tattoo, whether you're putting in an organ, whether you're putting in anything foreign into the skin, there's that possibility. Now, silicone is considered to be one of the most biologically inert materials on Earth. And what that means is it has one of the least likelihoods of having a tissue reaction to it. So now we have a purified form of silicone that was FDA approved that we can use, that we know doesn't have a lot of impurities or additives to it that could lead to this reaction. That doesn't mean that the probability of getting a reaction is zero, but it does mean it is minimal. The procedure does take a series of injections because we don't want to put in too much silicone at one point because it could migrate. So we're just putting in, I put anywhere from 2 cc's of silicone to 4 cc's, which doesn't mean a lot, but it's just a very small amount of silicone with each treatment. We then give the patient a rest of a period of 1 month. They come back after 1 month and we re-inject them. This gives the body enough time to wall off the silicone and fix it into place so that it will not migrate. I typically will tell people that it will take several injections to effectively treat the patient. Now, the number of treatments really depends on the severity of the lipodystrophy. We classify lipodystrophy into 4 classes, 1 through 4, whereas 1 is just mild lipoatrophy and 4 is the most severe lipoatrophy where people have lost all of their fat from their skin. So basically you're talking about their skin being draped over their skull. And with those patients, it can take anywhere from 5 to 7 treatments. I had a patient recently that told me that he didn't want to do it because he didn't want to get caught in the world of cosmetic surgery. And with facial wasting, this is not a cosmetic treatment. This is actually a reconstructive procedure because people have really lost what they already had. And it's a very disabling type of condition to have. People actually become shut in, they stop socializing, they feel very bad about themselves. And it's one of the most exciting things that I do because people come up to me all the time and they tell me how this procedure has changed their lives. Because now they're able to go out again. I mean, I see people get new wardrobes, get new haircuts, they join organizations, they start dating again, and they just really feel different about themselves. So it's a really terrific procedure to do for people's self-esteem.